They are, sat in the corner like moaning minis when actually their members are doing a really good job working with the government to improve patient care and experience.
So we had Wes Streeting today, the Health Secretary, interviewing him. And look, I knew that he was going to have a pop at the resident doctors, right, or the British Medical Association, who is the union that represents them, because he's been upping the language against them for some time over these strikes that they got planned for the end of December. I wasn't quite expecting him to go as far as he did, though. He described them as a load of moaning minis sitting in the corner. He said that they're acting like a bunch of juvenile delinquents. I mean, things don't get stronger than this. This is not language you usually hear a politician saying, right? But I think the overall thing is that I want to try and unpick is this a sensible way of interacting with the unions or not? Because I think a lot of people, right, will agree with Wes Streeting. I've been looking at the recent support for a junior doctors' strike or resident doctors' strike. This is YouGov. This was conducted on the 2nd of December, so it's very, very, very recent. The vast majority of people say they oppose it. 31% say they strongly oppose it. 22% say they somewhat oppose it. And the key thing is that this number has been changing, because there used to be way more public sympathy for doctors going on strike than there is now. I think there's a frustration, perhaps from the public, that they haven't accepted the deal on the table. Maybe that is because lots of people are feeling the pinch. We have that big tax raising budget, of course, and the feeling is that already resident doctors have had a decent pay rise. Those are the numbers, I think, Wes Streeting is looking at here. But I guess the issue is, right, is one thing being annoyed with junior doctors for striking or feeling a certain amount of resentment about it. But when it comes to the performance of the NHS, the only people who are really going to be blamed at the end of the day, I think, are the government. They've made it such a key point of their pitch to the electorate, improving the health service, making things better. And if they can't achieve that, then for whatever reason, whether it's the strikes, whether it's other combination of factors as well, they are going to be held to account on it, no matter how many times Wes Streeting says moaning minis.